have spoken out consistently against the cost of lockdowns as a means of controlling COVID-19, calling the global response a catastrophic public health disaster. Explain to our viewers, what are the biggest mistakes that have been made in responding to this pandemic?
Well, one of the principles of public health is that you can't just look at one disease. You have to look at public health as a whole. So with lockdowns, there are many collateral public health damages. For example, cancer screenings and cancer treatments that are not provided, worse cardiovascular disease outcomes, diabetes that's not taken properly care of. The mental health has been very tragic with increasing mental health problems. And of course, education for children not going to school. So you can't just look at one disease like COVID, you have to also look at the collateral damage that's caused. And one thing that we knew from the very beginning is that while anybody can get infected from COVID, there is more than 1,000-fold difference in the risk for mortality. So for older people, this is a serious disease, and they are at higher risk from this than from the annual influenza. But children, this is a mild disease, and they are at much less risk than they are from the annual influenza, which is already very low. So the logical strategy is not, instead of locking down the whole society, which causes a lot of damage from the lockdowns and other diseases and other public health and education, what makes sense is to the focus protection of older people so that they are protected, while children can go to school and young adults can live near normal lives. And now we have a vaccine that's very effective for older people. So the key thing now is that older people should get vaccinated, and then we should open up society.
Those who are pro-lockdown will argue that we've just passed 4 million deaths around the world due to COVID-19, and that number would be significantly higher if countries didn't lock down. What's your response to that?
Well, I think the lockdown approach in Western Europe and in the US have led to more deaths than a focused protection. So lockdowns are bad, let it rip, we do nothing is bad, but focus protection is what minimizes both COVID deaths and collateral damage. So if you look at the United States, for example, Florida was the one state that did focus protection instead of lockdowns, and they have lower mortality than the average of the US. So the US average mortality is about 50% higher than Florida. And Florida, of the biggest state in Florida, Florida has the lowest age-adjusted mortality rates. So focus protection has less mortality, both in COVID as well as for other things, than a lockdown approach. So lockdown can be used in the short term to sort of flatten the curve and make sure that hospitals are not overburdened for a few weeks or a month, but to drag it out for half a year or a year or more than a year, that's not good public health policy.
Well, in Australia, we've got a fairly unique situation with our international borders closed, and we've employed pretty much an eradication strategy where major cities lock down over just a couple of cases. Is that approach sound, and is there scientific consensus for lockdowns in that situation?
So Australia, as well as New Zealand, was able to hold the COVID deaths down for two reasons. One is because New Zealand is an island or two islands, and Australia, even though it's a continent, it functions like an island. So that means that you can quarantine the whole country much easier. The other reason is it was in the southern hemisphere. So when it first came, COVID, a year and a half ago, it was the winter season in Europe and North America, where the disease spreads very easily. So it was smart of Australia and New Zealand to position itself in the southern hemisphere so that it had the summer when the COVID came. So that's the reason why Australia and New Zealand was able to keep it down, the COVID cases. But you still have all the negative consequences from the lockdowns. So you can't do that forever, because you can't sort of push things forward forever. So now when there is vaccines, as soon as you have vaccinated all the older people above 60, say, there's absolutely no reason to have lockdowns anymore. We also see that children actually need to build up their immune system, and for them, COVID is a very mild thing, milder than a common cold. So they need to build up their immune system. Otherwise, they are going to have a whole range of respiratory illnesses because they're not exposed to viruses and germs.
And just lastly, Professor, our biggest city in Australia right now, Sydney, is locked down. Looks like the lockdown could even be extended due to an outbreak of the Delta variant. We've been told Delta is a game changer. Is that true? Is the Delta variant particularly dangerous?
No, that's not true. So a virus will always mutate. So there will always be different variants. That's not strange. And sometimes you get a variants that are a little bit more infectious, or that it spreads a little bit more easily. But the key thing is that the Delta virus is the same in terms of it affects older people but not younger people. So if you suddenly get a mutation so that younger people start dying, that would be a game changer. But that's not the Delta variant. And also if the older people are vaccinated against that also protects them against the Delta variant. So it's not a game changer, and it's nothing that we should be specifically concerned about.